friends, and welcome to another episode of Heroes Headquarters. Today, we celebrate the tireless and extraordinary efforts of CRAN's Medical Advisory Board member, Dr. Anand Govindarajan, a surgical oncologist who treats peritoneal malignancies at Mount Sinai Hospital in Toronto. And at the same time, we honor the brave and remarkable journey of long-standing CRAN member and stage 4 survivor, John Kutkevicius, whose colorectal cancer was discovered to have traveled to his peritoneal lining in his abdomen. Today, after having undergone successful treatment, he's not only surviving, but he is indeed thriving, thanks to Dr. Govindarajan and his team at Mount Sinai. Sit back, my friends, and listen to this incredible story moderated by Mr. Ryan Clark from Eversana, Canada. I promise you, you can't help but be inspired. Thank you.
Dr. Anand Govindarajan is a surgical oncologist at Mount Sinai Hospital and Princess Margaret Hospital, associate professor at the University of Toronto and adjunct scientist at ICES. He is also the provincial clinical lead for survivorship at Ontario Health, Cancer Care Ontario. Dr. G, his clinical practice involves the care of patients with gastrointestinal cancers with a significant focus on peritoneal-based malignancies. He also sits on CRAN's Medical and Scientific Advisory Board. John Kutkevicius was diagnosed with colon cancer in February 2019 at the age of 60. The colon cancer had spread to his peritoneum, that's the tissue that lines the abdominal wall. He approached CRAN looking for information about HIPEC and a physician who could perform such a surgery. John also sits on CRAN's Patient Advisory Council. Dr. G, tell us about your practice and how you help to support patients through their journey.
Thanks, Ryan. So I am, as you mentioned, a surgical oncologist, and my entire practice revolves around the care of complex cancer patients. So patients with recurrent disease or metastatic disease. And of that, I would say the majority of my practice involves the care of patients with metastatic disease to the lining of the abdominal cavity, the peritoneum. I'm part of a program at Mount Sinai Hospital with 2 other surgeons, and we're the only program in the province that's been designated for the care of this group of patients. And so we aim to take the best care we can of patients throughout the province, whether they're from Toronto, Windsor, or Thunder Bay. We have many aspects of their care that we have to support. As you know, the diagnosis is quite difficult, and we aim to treat not just the medical aspects of it, but we aim to provide support both to the patient as well as to the caregivers, because getting through this is a team effort, both on our side, but also on the patient side.
And John, perhaps you could tell us a little bit about your journey and maybe even tell us a bit about not only the first time that you met Dr. G, but your engagement with CRAN, that sort of thing.
Okay. Yes, Dr. G was actually the third doctor that I met, but as you mentioned, I was first diagnosed on February the 1st, 2019. So I'd actually left work a couple days earlier and just lied in my bed or laid in my bed for a couple days before going to emergency, as the pain was just not getting better. And once I got there, they decided I just needed emergency surgery to basically take out 8 inches of my colon. Fortunately for me, the doctor, and this is one of the lucky breaks that I've got along the way for sure, the doctor that did that surgery was actually a doctor that had been working with Dr. G for several years previously, Dr. Hamid. He immediately knew what my problem was and informed my wife and my older son, who was there at the hospital, even gone further, basically sort of told them the path that I needed to go. But after that surgery, I I got an appointment with an oncologist, Dr. Towns, who then basically told me the same kind of thing, where I needed to go, but basically put me on a path for chemotherapy, which I needed to do for 12 treatments for 6 months, which was going to be the predecessor to the surgery that Dr. G ultimately ended up doing for me. But after that meeting, well, basically my wife and my elder son did all the research that they could to try and figure out what was happening, and because I really didn't know anything about it. And I remember one day my wife was calling, and she actually called Philomena from Cran, and then she came. I was lying in bed, and she came. She goes, "You're not going to believe this, but I talked to this lady, and she knows everything about everything." And so so we then, as you said, there was a meeting coming up, and with this group, and we should go to that meeting. And so we went to that meeting, and actually it was really another lucky break for me, basically. At that meeting, there were two individuals, two men there, who had gone through this exact HIPEC and so I think the full name was cytoreduction and HIPEC, and they had gone through this procedure already and had lived to talk about it, and they explained everything about it to me, which really gave me a perspective on things going forward that I didn't have at all before going to that meeting, and was, I think, instrumental in bracing myself and thinking about how to move forward in the future. I was accepted into the program for Dr. G to do the surgery, which in November of 2019. And that surgery actually is leaves a bit of uncertainty to me as well at this point. And I'll just share this. The Dr. Towns, my regular oncologist, had told me from the meeting that the chemotherapy would never cure me, and that I would need this cytoreduction and HIPEC surgery. But then after Dr. G did the surgery in November, it turned out that, I don't know if I can't remember all of it, but 10 or 11 pieces of whatever he took out of me went to pathology, and none of them showed any cancer. So I was quite worried that somebody had just made a mistake, that because the chemo should never have cured me. There was the surgery that needed to cure me, and the HIPEC and whatever. So I'm still confused to this day about why I'm still here, and how it worked. But anyway, the results of Dr. G's surgery were that no evidence of disease. So that's that's where I am today.
That's wonderful, John. Thank you for sharing. Dr. G, can you tell us a little bit about the procedure itself?
Sure. Yeah. So it is a long process from the moment of diagnosis through all the different treatments. And I think maybe one of the things I would emphasize is that although I'm a surgeon who operates on peritoneal cancers, the full treatment is not just me. It is a package of treatment that includes systemic chemotherapy with Dr. Towns, as John mentioned, and then as we go, as he mentioned, we assess to see whether the surgery, which is quite extensive, which I'll talk about in just a second, is going to add benefit on top of that. So we do know from data that there are cases where the surgery is beneficial, and that has to do with how much there is, as well as where it is. And we also know that there are cases where the surgery actually doesn't add benefit. And if it doesn't add benefit, and John definitely agree to this, it's a very extensive surgery. And if it doesn't add benefit, it's just giving risk. And that's not doing anyone any favors. So the qualification is about us trying to determine whether the surgical piece is going to add benefit, given how extensive it is. And we do sort of emphasize that it is a full treatment package that includes systemic chemotherapy and the surgery, which includes both, as he mentioned, the cytoreductive surgery, which removing anything that even remotely looks like cancer, could be treated cancer with chemo, and then adding the HEC, which is the heated chemotherapy component. So it's essentially a three-part treatment, really. The surgery itself is extensive. It's one of the most extensive to do. It's a full exploration of the abdominal cavity, removing cancer from wherever it happens to be within the abdominal cavity. Sometimes removed, sometimes the cancer can just be peeled off. And once all that's done, then the HIPEC component is essentially washing the abdomen with hot chemotherapy to try to kill off any microscopic cells that that may still be there. So the removing the cytoreductive part removes the cancer you can see. The HIPEC, the idea is that it helps to treat the cancer you can't see. And that's the procedure in a nutshell. It takes hours. I don't remember, John, how long yours took, but it can, I've done anywhere from 6 to 20 hours to give a sense of extensiveness, which is why we have a fairly rigorous process to make sure that the operation is going to help, because at the end of the day, that's what we want to do.
Thank you for the clarification. Appreciate that. John, you mentioned the importance of CRAN and connecting with CRAN, but can you tell us a little bit more about how you and your family sort of got through this journey together, and what you were feeling, and all that you must have gone through emotionally and that sort of thing?
So yes, it's quite a hit when someone tells you you have stage 4 colon cancer. You really don't have much of a choice. You just have to figure stuff out and do the best you can, and that's why you appreciate the organizations like CRAN and the doctors like Dr. G. The other thing I was going to say is, that surgery, I was told, Dr. G, it was about 10 or 11 hours that the surgery for me, but it was then 15 days in the hospital after that, recovering, and before I left. And I greatly appreciated when you would come into the hospital, not saying your junior, I forget his name now, who helped out in the surgery and whatever, didn't have the bedside manner you did, but I think you were very appreciative of the there's a situation that we're in the hospital, and you helped on a number of occasions make it more bearable than it otherwise would have been. So I just appreciated everybody's help along the way. My wife and family, that CRAN and Philomena particularly, and Dr. Towns, Dr. G, and even the luckiest break, I think, was having Dr. Hamid right off the bat, who used to work with Dr. G. So, I was informed as much as I could through the process. And I think that's the key for anyone, is that the anxiety goes away a little bit when you sort of know where you're going or where you have to go. You don't know whether you're going to get there, but at least what to expect, that reduces your anxiety to a significant degree. At least it did for me.
Certainly sounds like your family and the care that you received from Dr. G and at the hospital and everybody really made all the difference. So, Dr. G, just in closing, do you have any words of wisdom for patients who perhaps are starting to embark upon a similar journey to the one that John has shared today, and anything you'd like to perhaps tell us?
Yeah, I think for most patients, for most of the people we see, this came out of the blue. And they had a normal life until this diagnosis was made, and it's shocking, and it can be quite devastating, and you can feel quite alone. And I would say that the wisdom I would say is that you're not alone, and this is a long journey, as I've sort of talked about, from start to finish. And even beyond surgery, John still has tests and we still follow whatnot. So it's a long journey. The initial shock of it can be quite devastating. I personally think the way to get through it is to maximize the support and that you surround yourselves with. So family members, John and Kathy, obviously very involved in their care, and also this, and I think this is where organizations like CRAN come into play as well. You aren't alone. There are others who have undertaken whatever journey you will undertake. Someone else has done it, and by getting plugged into a network, you can get a sense of what the future may hold, and from people who have navigated it before you. And I think that helps. Is it perfect? No. Perfect would be not having the diagnosis. But I think it can help navigate uncertain times. A lot of stuff goes through your head when you get a diagnosis like this, and I think knowledge is very helpful. Talking to people who have been through it is very helpful. Arming yourself with support and information, reliable information. There's a lot of information that is not good, and I think organizations like CRAN and patient support networks are sources of reliable information, and I think those are things that you can that I would say I have found really seem to help patients navigate the long journey that they are now on.
Thank you to both of you sharing your story today, and I really think it does highlight the theme of this series, of course, which is the heroes and the hope that goes along with that. Thank you.